I'm James Taylor, and I actually hurt my back in Daytona riding motorcycles during bike week. Come home, went and seen the chiropractor. Just thought it was something he could take care of. Long story short, after about, 2 months of going and seeing Dr. Dixon, it didn't get any better. So he walks in one day and I ask him just straight up, be honest, you gonna be able to fix this problem or not? Goes out, gets my x-rays, brings them back in, says, man, needs to see a surgeon. So we start looking, we go to, I believe it was the Vanderbilt Bone and Joint Clinic in the beginning. They done MRIs, couldn't find anything. I think they were basically, gasping at strings. Put me on Lyrica, some kind of medicine to kill the pain. So that wasn't getting anywhere. I needed a fix. So we quit going seeing those people. Went to Columbia, to the Bone and Joint Clinic over there, Middle Tennessee Bone and Joint. They about the same way as it was up there. So, at this point, it ain't gonna get any better. I don't know. Good friend of mine, Jim Patterson at Dixie Diesel, Dr. McCord had just fixed his back. Jim calls me and tells me after he comes back to work how good he was feeling, so I made an appointment to come see Dr. McCord. Talk to him, he does the MRIs, the discogram, CTs, all that, tells me what I need done. So I go for a second opinion, I see Dr. McCombs. Same thing he says. The difference in the two doctors, McCombs says I'd be out of work 6 months. Dr. McCord says no more than 3. Actually, I was back to work 2 weeks and 7 days. If anybody's considering back surgery, anybody I know, I send them to see Dr. McCord for the simple fact that he's going to put you back to work quicker than anybody else. McCord situation, you go through the front, you put the gauges in, then you go through the back and you fix the back. McCombs does it all through the back, so therefore that's why you're down longer on the healing time, because they actually cut the bones in two to replace the cages, or to remove the disc and put the cages in. That's why I didn't want that, because faster I can go back to work. I'm a self-employed person, so the faster I can go back to work, the better off my family is. The longer I'm laid up in the bed, the less money I got coming in other words, So that's the reason I picked Dr. McCord. I'm fortunate, 8 or 9 weeks now since I had back surgery. I'm limited to the pain medication I take. Take it once a day in the morning when I get up, due to the fact that I'm stiff and sore from sleeping all night. Gonna have to have it the rest of the day. So, I feel like in 3 months that I'm gonna be totally off everything. That's what I'm shooting for. And get to ride my motorcycle again, because we hadn't rode motorcycles in about 1.5 years now since I blowed my back out in Daytona. So, that's just my feeling about the situation. Is anybody wants to be fixed and go back to a normal life, they need Dr. McCord to look at your situation. I've recommended several people, and actually personally bringing a dear friend of mine to see Dr. McCord on the 4th of next month that has had 3 back surgeries by other physicians, and he is actually bedridden. He can only get out of the bed 2 days out of a month. And I want Dr. McCord to look at him, see if he can do anything for the man. I talked to several people before I'd actually let anybody cut on me, and you can ask my wife or Dr. Dixon or anybody. After the first time I walked in McCord's office and talked to him, that was about the most comforting, I should say, that I had felt about anybody I had talked to, because I didn't like the way anybody else had talked about what they were going to do to my back, how long I'd be down, or what I'd be limited to after surgery. Felt more comfortable. So, I guess if I had to have back surgery again, I know where I'll be going. Hopefully I don't, but if I do, I know where I'll go.